Dubai is really booming. The French butt is small. The French breast, I really love it. This is the French butt reshaping FBR.
Welcome to the third episode of Aesthetic Talks, brought to you by Aesthetic Links, the first platform which features only the most trusted aesthetic clinics in Dubai. Today we're super honored to have Dr. Matt Stefanelli with us, French surgeon, and he's going to talk about a lot of exciting stuff, including French touch in plastic surgery. Let's get started. Dr. Matt, it's an honor to have you today. How are you doing?
I'm very fine. Thank you so much, Ivan, for having me and for this aesthetic talk. I'm ready.
Amazing. So if you don't mind, if you could please introduce you for the viewers, that would be great.
My pleasure. So I'm Dr. Matt Stefanelli. I'm French. I'm a plastic surgeon. I'm French and European board of plastic surgery. I'm living in Dubai since now 8 years, since 2017. And basically my practice is mainly oriented to aesthetic surgery. But I do also some non-surgical treatment and also some reconstructive surgery case. This is for my clinical activity, and I have also a very important educational activity. I'm professor of anatomy, and I'm running an academy that is aiming to train doctors in Dubai, but also worldwide.
That's amazing. So for how long have you been a doctor now?
So I'm 50 years old, and basically I started medicine when I was 18. I stayed in France for almost, I would say, 15 years. So it depends when we make the starting point. I start my medical studies when I was 18, so it will be 32 years. But for surgery, I started when I was 25, so now it's 25 years. We have a training, and I will say now, as a senior plastic surgeon, I'm running now 15 years.
Wow. And how long in Dubai? Why Dubai also?
Yeah,
the big question.
So 8 years in Dubai. There is, for me, 2 different periods, before COVID, after COVID. So I arrived in 2017, before COVID, and the first 2-3 years, I was mainly in Dubai for educational purpose. I was not living really in Dubai. I was, part-time. I was still in Paris, and 1 week every 2 months, I would say, in Dubai. Running, as I was saying, workshop to train the doctor, because there is a big demand of education in Dubai. We will speak about that later, I guess. And then when COVID started, it was difficult for in France to continue, to practice normally. So I decided to move to Dubai and start now a full-time activity. So this is my story in Dubai. 8 years, but really 5 years, full-time.
That's interesting. And actually, I'm going to ask you, do you see a big difference pre-COVID, post-COVID?
Massive. About my practice and also about Dubai and about both. Well, I think you are also living in Dubai. You saw that now since, I would say, 2 years, not only about COVID, by the way, also, with some conflict around the world, we see a massive flow of people in Dubai. Up to 2023, I never saw really traffic in Dubai. And since 2 years, the traffic increased a lot. And it comes with everything else, much more patient, but also much more doctors, much more clinic. So Dubai is really booming. Yeah. On one hand, I think it's good, because this is really a very futuristic city. On the other hand, it started to be a bit crowded. Yeah. So it's not easy for the patient to know exactly where to go. Yeah. It's not easy for the doctors also to reach and to catch patients, because the offer is more diluted. So, but definitely there is a big difference since COVID, and I would say even since 2-3 years.
Amazing. So that's the reason we created Aesthetic Links.
Absolutely.
Obviously, that's
very good idea. Very good idea.
That's
very smart. Yes, absolutely.
Thank you. Yes. That's a jumping point for me. So the viewers who don't know about Aesthetic Links, so it's platform which only based on word of mouth puts forward the best clinics with the best doctors. That's why I was saying that we're lucky to have you today.
My pleasure.
And so talking about Dubai and education around medicine and plastic surgery, especially training. How does it work? You were saying that there's not much.
So Dubai is a very unique city in many different aspects, but coming to medicine, in the sense that it's one of the only city, I would say, country in the world that allows doctors from all around the world to come and work here. On the other hand, there is no what we call postgraduate medical university. So all the doctors in Dubai, basically, they have been graduated elsewhere, abroad, either in Europe or in the US or from any country in the world. Of course, there is a very strict process of accreditation, of evaluation, of licensing. But basically, this is possible. And that's why the medical community in Dubai is so cosmopolitan. We have basically doctors from all around the world. And of course, also patients. Last year, I remember I saw something like 2,000 patients from 80 different countries.
Wow.
When I was in France, even I was in Paris, I was seeing patients from France, sometimes from Switzerland and Belgium. That's it. But in Dubai, this is a completely different story. It's very cosmopolitan, both in doctors and patients.
Being a French doctor, do you attract a lot more of French clientele, or how does it?
Definitely. In Dubai, we notice that it works by community, by country, by language. It's very important, for a patient to be able to speak very closely with the doctor, if possible in the same language. So being French and being almost the single French plastic surgeon in Dubai, naturally, I would say a lot of French patients.
Yeah.
Not because I'm the best, but just because I'm French. Then many European. I'm speaking also Spanish and Italian, so I attract also these countries, and also South America, because speaking Spanish it gives me a lot of Latino American patients, because people know that I'm speaking Spanish. Very important community and language, very well represented here in Dubai. So I would say 80% of my patients are, let's say, European, and 20% are from Middle East. Not only from the UAE, but from all Middle East. Yeah.
Super interesting. And now I understand the link with South America, which we'll touch base soon. So without further ado, I think we'll jump to the biggest part of each episode of Aesthetic Talks, which are the treatments. And so just for the new viewers again, a little piece of information. So I'm not the specialist in treatments within Aesthetic Links. This is where it's funny. I have that really novice opinion. I heard about the treatment and more because I know the platform and everything that's listed on it from a marketing and product angle, but it's super interesting. And we'll get started, especially with today's big subject, the French touch in general.
So what is the French touch? Long story short, French touch is summarized by moderation. You know that in France, aesthetic surgery is not very popular. The patient, they almost want to hide their treatment to the husband, to the boyfriend, to the family. It's not very popular, and therefore, for us, plastic surgeon, French plastic surgeon, we need to adapt our treatment to make it as inconspicuous as possible. So, for example, when we do a facelift, it's going to be very subtle. When we do a breast augmentation, it's going to be a very moderate volume. When we do the body, subtle definition. When we do the butt, not big, small hips, small butt. And everything is going to be subtle, small, and moderate. This is the definition of the French touch.
Interesting. So let me actually stop on something you mentioned, and it's super interesting. You're saying about hiding treatments. How's your experience with that? I'm super curious. And is it different in the Middle East than it is in France?
The mindset of patient is very, very different from one country, or let's say one continent to the other. In some countries, patients want to show off a little bit of plastic surgery, like if they were, wearing a jewels or a watch or driving a fancy car. In other countries like France, it's completely the opposite. They want to hide. They are a bit ashamed, of admitting that they did a surgery. So, for example, in South America, they have, these big boobs, big butts, and they like to show, and they don't hide it. They do plastic surgery and they say it, and this is like, a sign of social status. They have access to plastic surgery. So they want more, they want bigger volume, bigger curves, bigger everything. And the European style is the contrary. So we need, as a doctor, to adapt our, treatment to each mindset. Is very important to make sure that, we understand the personality, the goals of the patient, because not every patient, every woman, every man is the same. And the country matters, but not only the country. We need also to go into the details of the personality of each patient.
Yeah, and especially I imagine here in Dubai, as you're saying, Dubai is a massive melting pot,
exactly.
Right? People from all countries, so I imagine it's even harder to adapt because you're not adapting to a specific country or a specific taste. Here,
exactly.
From one patient to the other, it could completely change.
Completely different. Very interesting practice. And to be honest, even, my practice changed from Paris to Dubai. I can tell you in which direction. As you know, population is younger in Dubai. We don't see so many, people 50 plus. All my patients, they are between 20 and I would say 45.
Okay.
So what is the consequence for me in a plastic surgery practice? I do more body surgery than face surgery. Because, facelift, it's not very common to do facelift before the age of 50. So when I was in France, when I was in Paris, I was doing 1 or 2 facelifts per week. Okay. Now I do 1 or 2 facelifts per month. And on the other hand, I do much more body contouring because, when do you want to do body? You want to do body when you are 25, 30, 35, maybe 40 after your pregnancy. So you don't do it when you are 60. It's quite interesting to see, at least for me, my evolution in practice from face to body, from Paris to Dubai.
Yeah, that's super interesting. I didn't imagine there was that.
I had to adapt, of course.
Amazing.
Yeah.
So diving into everything French.
Yes, let's go.
What about French butt?
Yes.
How do you...
So the French butt, The French butt, it was quite easy for me to get this concept because we see all this huge butt, huge curves, especially from South America, from Colombia, Venezuela, etc., with a very tiny waist, these very wide hips, very, projected butt. And this is not what, French and European patient want. At least they don't ask me that. And also because, patients are coming to me because they know me, they know my style, and I attract patients like me. It's always, the same. The patient needs to identify himself to the doctor. So they know that I'm French. I'm, advocating, speaking a lot about the French touch. So I don't see very commonly, patient asking me a huge butt. I will tell you maybe an anecdote after I had some exception. But generally speaking, the French butt is small, athletic, round, looking very good, not only in dress, skirt, but also in pan, which is, very good reveal because you can hide with the dress, but you cannot really hide in pan. And not big hips, not big butt, but very, I would say, round, perky, like a little pretty butt, I would say, So this is the French butt. And from the patient request and from the doctor's technique, the medical technique, how we do that? We do that with a combo of 3 techniques. Liposuction. We do some liposuction in the belt, abdomen, waist, and lower back. And then this fat is going to be reinjected in the hips, to fill this little hip depression that we call hip dips. Okay. And then, because most of these patients are skinny, they don't have so much fat. If we want a little bit more projection with the butt, we are going to use a butt implant. Let me take, for example, one of these. So this is a silicone implant, quite similar, to the breast. Actually, there are different size, different shape, but basically they are always round. They can be smooth or like this one, micro texture, like a little bit velvet. And the particularity of the butt implant compared to the breast implant, we are not going to put it on top or below the muscle, like in the breast. We are going to put it inside the muscle because the muscle is much thicker, 4 or 5 centimeters. So we are going to open it like a book and to make, like a burger. Yeah. So the implant is going to fit inside the muscle, like the steak will fit into the bread of the burger. And this is the best technique. We call that the intramuscular pocket. And this is the best technique to combine at the same time safety, efficacy, and to prevent, all this catastrophe we see on the web with this butt implant, flip-flapping, turning below the skin, with the patient putting it back. So this is the French butt reshaping FBR.
Super interesting. And let me ask you 2 questions.
Yeah.
1, how long does it take? And 2, is it made for any body type? Because it's a small implant, so does it work for anybody?
Very good point, Ivan. Thank you for asking. So I always say the French butt is for everybody.
Okay.
I mean, at least the concept, because the implant, we can always use an implant. Even if a patient has enough fat, the main message is to say the fat and the implant are not going to give the same result. You know, what is the difference between the breast and the butt? A butt is mainly muscle. It's a little bit more firm, more athletic, more muscular, while the breast is a gland. It should be softer. So firmness is positive in the butt. Firmness in the breast is not so positive. Patient, they ask you soft breast, but they ask you firm butt. So that's why the implant is giving you this firmness, which is, I think, positive, which is good for the butt. While in the breast, sometimes, you know, you see the breast too firm, and this is not really usually well accepted and well liked by the patient. So the implant in the butt is going to give you a more firm, athletic, round, sporty butt. While the fat, if you do, you know, the so-called BBL, Brazilian butt lift, just with fat, is not going to give you a really athletic butt. It's going to give you a little bit fatty butt, you know, with this booty shake, you know, trend, especially in the US, where patients, they are moving their butt like this. It's moving a bit too much.
Yeah.
A butt should not move too much. A breast, yes, should be mobile because it's soft, but not a butt. So that's why I always try to inform the patient about the implant, even if they have enough fat.
Okay.
At the end of the day, Ivan, I have to say that I do 3 times more BBL, only with fat, than FBR, the French butt, combining fat and implant, because implants are not very popular, you know, for the butt, I mean, and patients are still a little bit reluctant. It's well accepted to have implant in the breast, not so much in the butt. But I am one of the, I would say, world expert in butt implant, and I feel that this is also my mission to explain that butt implant are a very good option, but a little bit more technically demanding. And yes, it can be risky if not done properly.
Very interesting. And the duration of the operation for it?
It depends what we do, you know, in terms of body surface. If I just do the lower back liposuction, hip lipofilling, and butt implant, it's going to take me 2 hours.
Okay.
But very often, I need also to do the front. So I'm going to turn over the patient. I do the abdomen liposuction. Eventually, I do also the arms, the thigh. So I will say from 2 hours, and if I do the full body, up to 5 hours.
All right. And how does the recovery look?
Yeah, quite interesting, because patients, they are afraid how they are going to sit or to sleep with the butt implant. So usually I am asking my patient for at least 2 weeks up to 1 month to be very careful, and especially to avoid sitting. So you are going to ask me, how is it possible not to sit? Well, just let me tell you that sitting is not a very healthy position. It's a very sedentary, you know, position, not good for our joint, our posture. We are, you know, in a closure position. And, you know, some big companies, so for example, in Napa Valley, there is no chair. Everybody's standing up, you know, on what we call cocktail table, and they work standing up. So I'm telling my patient to do the same, to stand up as much as possible. To lay down, it's not a problem. They can lay down, whether on the front or on the back. It's not really affecting the result. But the main point is not to sit for at least 2 weeks. Why? Because the implant being inside the muscle, after we need to close the muscle. Yeah. And the muscle, when you sit, is put in tension and can open. This is one of the drawbacks of the risk of this technique, the opening of the muscle and the opening of the wound. By the way, the wound is the scar, I would say, is very specific. It's not like for the breast, 2 scars. It's only 1 scar in the center, in the intergluteal, you know, crease. So, and you can imagine that this is not a very favorable, you know, zone. We are close to the anus. It's not very clean. It's a bit wet. So there is a tendency of opening, especially when the technique is not correct and the implant too big. So that's why I always put small implant. Very important. This is part of the concept of the French butt. Nothing is big. So we put small implant, not more than 300, like this one, and little amount of fat also. So that's the French butt.
Is there a need for follow-ups to check that how often?
Very good point. Also, we follow up the patient both clinically, 1 month, 3 months, 6 months, 1 year, and basically anytime. I give my WhatsApp to all my patients, so they can reach me 24/7. And sometimes we need to do also ultrasound if there is a doubt of any problem, and eventually MRI, magnetic resonance, where we will have the best picture of the position of the implant. Sometimes the implant are flip-flapping. We can see it very well on the MRI. Sometimes the implants also rotate, but because I'm using round implant, it's not so much affecting. But some surgeons, they use anatomical implant, not round, but like a pear shape. So if it's rotate, it's going to affect. So the follow-up is very important. But I want to mention something very key for me, that butt implants are much deeper than breast implant. The breast implant, whether you put below the muscle, above the muscle, it's always here. You feel the implant. Right. It's close to the skin, let's say 1-2 centimeters maximum. But the butt implant is much deeper. It's deep in the pelvic cavity. It's between the bone, like the sacrum, the iliac crest, the trochanter, the ischial tuberosity. So you don't feel it because it's so deep. Patients, they avoid it. They forget it. Yeah. They forget it. It's just deep inside the body. And very often they are very well accepting the implant, and it's almost forever.
Right.
If it's there is a need to change it, it's just because the technique was wrong. The implant is too superficial or rotate, but with a proper technique, we can avoid that.
So now it's a great way, I think, to transition to French breast.
Yeah, French breast.
You brought all of these implants,
as you can see here,
got me excited.
I brought a couple of implants because we have, of course, the silicone, but we have also other composition, like for example this one, the polyurethane, which is very interesting implant if we want more stability. When, for example, the skin is a bit loose. We have also one called the B-Light. This is basically a much lighter implant, 30% less. And if you don't mind, I would like to make a test with you, if we can make that. Look, this is the same implant, the classic one.
Yeah.
Like put it like this. Yeah. All right, good. And now on the same hand, replace it immediately and see the difference. You see?
Oh, yeah.
Big difference.
Massive difference.
So this is the same volume, but 30% less weight.
That's great.
It's called B-Light. So you can imagine easily all the advantages.
Yeah.
For example, patient when they bent, down. Recently, yesterday, I had a patient. She's a dentist, so she told me I want breast implant. But when I'm going down like this, flexing down, bending down on my patient, I don't want massive weight. So I propose her the B-Light, and we schedule the surgery for B-Light. So also on the long run, it's not going to stretch the tissue. The implant is not going to go down. So the breast implant, I would say, activity is evolving a lot. We have a new generation of breast implant. It's quite interesting. As I said, I'm 50 years old, so I had to use all the different generation of implant when I was 25, then I was 35, 45, and now 50. So I'm amazed to see the evolution of the implant. There are very different, implant in terms of size, shape. I like to mention also another one called Motiva. Motiva, they have probably the best gel on the market. It's very flexible. Right. The implant is round, but when the patient moves, sitting, laying down, or exercising, is going to follow the movement. So very natural.
Okay.
And you can try. It's very soft. Patient, they love that because, as I said before, a breast should be soft. Firmness is not positive. In a breast. The breast implants are still a very important, aesthetic surgery, and we have a fantastic new implant.
How would you differentiate normal breast implant then from French?
So the French breast comes from one French plastic surgeon, Dr. Eric Auclair.
Okay.
Unfortunately, he died recently. 20 years ago, basically, he launched the concept of hybrid or composite breast augmentation with the combination of implant and fat. It looks very simple. But at this period, it was really, very new. And we call the French butt this hybrid augmentation. So basically, we are going to use a silicone implant, but smaller. And this is very good because smaller implant, smaller problem. On the other hand, big implant, big problems on the long run.
Oh, really? Okay.
So we decrease the volume. So instead of putting 350, we are going to use, for example, 250. And above the muscle, which has a lot of advantages also, because, everybody think below the muscle is better. No, not always. Believe me, there are some problems because the implant below the muscle can move when we contract. We can have what we call animation deformity. So it looks weird when you move. It can be also more painful because we detach the muscle from the ribs. So it's not true to say the under the muscle implant pocket is the gold standard. If we can avoid that, better. All right. It's mainly for big implant. But the idea of the French breast is to decrease the volume of the implant and to compensate with fat. So we are going to do a liposuction, for example, in the abdomen or around the breast. And this fat is going to be placed especially in the décolleté, in the upper pole, to complete the treatment. So the French breast, I really love it. I speak about it. I present to my patient. They love the concept. Of course, it's a little bit longer procedure because breast implant is never more than 1 hour, between 30 and 60 minutes. If we do the French breast, we need to do a little bit of liposuction. So maybe it's going to add half an hour, 1 hour to reinject the fat. So maybe it's going to go to 2 hours. But on the long run, this is probably the best combo.
Amazing. And that works with all of the implants, that you have shown today.
Yeah. We have a big, range of implants. Yeah. It works fantastic with the last one. If you can give me the Motiva.
Sorry.
So this one, the Motiva, is very soft. So and the fat is soft. Yeah. So you use a soft implant with also soft fat on top of it. So at the end of the day, it's going to be even softer and even more natural. Because I always compare the implant to the foundation, and then the fat is going to be the small touch-up, the light, the painting, like when you build a house, and it's you have the best of both worlds. So I love the combo. The composite,
amazing.
The French breast.
To keep in the French subject, how does it translate to the French facelift?
As I said at the beginning, basically there are really two very clear trends when it comes to to face aesthetics. You have the extreme look that we see a lot, for example, in Russia, or in Eastern Europe when they want to have very high eyebrows, high cheekbone, very straight jawline, very pointed chin, very small nose, big eyes, big lips. So this is, this Russian style, I would say. And on the other hand, you have the French style, again, very subtle, moderated, not too much. So the eyebrow, not crazy, high, little bit, reposition. The jawline also very subtle, not too sharp. The chin never too big, never too pointy. The nose should stay normal, not like Michael Jackson. Yeah. The eyes also, everything's subtle. Yeah. So the French facelift, is all about these small details. So we want to refresh the face, but we don't want extreme look. Yeah. That will sign, the surgery. So again, a good example is the eyebrows, because you have different position of the eyebrows and the temple in general. And we want to open a little bit the eyes, but we don't want to have the eyebrows like this, like the devil. Right. Yeah. So when we have this European patient, we propose this French facelift, very subtle, moderated, for I would say elegant.
Right.
Okay, refreshing. No transformation, just refreshing.
I understand. And how does that translate in Dubai? Quite curious for the region.
Again, a very cosmopolitan patient. So the origin of the patient matters. Yeah. So for European patients, usually we do this style. And I have also patients, for example, from Turkey, from Eastern Europe, from Russia, and all Soviet countries. Usually they want more, the top model look, Bella Hadid look with these cat eyes, fox eyes, cheekbone, very, very sexy, very, very big transformation.
Right.
And after it's a discussion case by case. Of course, I can do it, but it's not because I can do it that I will do it. It depends the discussion with the patient. But usually when I feel that the expectations are too high and the demand is too extreme, I prefer to refuse because I always say the patient, they choose their doctors, but the doctor can choose the patient also.
Right.
Can choose at least to do or not to do a surgery.
Of course.
And as a doctor, I always think about the worst scenario, about complication, about unsatisfaction of the patient. So if I do a good surgery technically, but the patient is not happy because she wanted higher, bigger, whatever, more, it's going to be a failure. So I don't want that. And I don't want to go beyond, my principle to make one patient happy, because when you do this, you can have problems.
Of course,
bigger implant, bigger problem, bigger pool, bigger problem. Maybe the skin will not heal perfectly. So this is the French facelift.
Amazing. So we've heard a lot about French touch, which is super moderate and it's super interesting, and it's a style in itself.
Yeah.
Now, I'll try to catch you on body contouring.
Yes.
As I know your links with South America, and things are different there. So what's your view on that?
Very interesting. So first of all, Ivan, let me tell you very quickly a little bit the history of liposuction. So liposuction was invented in France by Dr. Illouz in the 80s. And at this period, it was a very basic liposuction. They were just removing some fat with very basic, instrument, big cannula, aspiration coming from the wall, and everything with the strength of the surgeon, and very tiring, and to be honest, very boring. And this is this French traditional lipo that I did for the first, I would say, 10, 15 years of my practice. And to be honest, I was not interested at all. And also, as I told you, when I was in Paris, I was doing more face surgery, and I was not doing so much body, and I was neither very interested by that. And then, I would say 11 years ago, exactly, I remember it was 2014, I went to Colombia and I met Dr. Alfredo Hoyos. Yeah. And Dr. Alfredo Hoyos is very famous because he's the inventor of the modern liposuction. I would say the modern liposculpture, because we don't now just remove fat, we also re-inject fat. So liposuction, lipo-injection. And he's Colombian. Yeah. But he's just a genius, really a genius, because he understood better than anybody really the art of the body anatomy. And what everybody is able to see with its own eyes is going to translate it, in surgical technique. And every single contour in the body, either for male or for female, is going to be, addressed by a surgical technique. So from a very boring surgery, it becomes a very interesting surgery, and it's called the modern high-def liposculpture. And as I told you, I started this 10 years ago, and I'm in Dubai since 7 years. So from not really doing body sculpting, because of this Colombian influence, because I'm working with this Alfredo Hoyos since now 10 years, he's becoming a very close collaborator, very close friend. Also, he's sometimes coming to Dubai, also I'm coming to Colombia. So we have this duo together since more than 10 years. I developed this body sculpting activity because of this Colombian influence and because my move to Dubai. And now I would say that for the body, I don't really do the French touch body contouring. Right. I do what I will call a hybrid body contouring. It means more than a classical French, but still a little bit less than a South American. I'm not extreme as my colleague from South America, where they will go very, very strong, for example, in the waist snatching. They will go still big in the hips and in the butt. So I have this double, influence. And I think people understood that. So, because very often I have French people, they told me, we come to you, doctor, because you are better than the classical French. You do more definition, more details. And they tell me also, but we didn't go to the Colombian because we don't want extreme like Colombian. So I am in between both, and this is my style. I will call it the hybrid body contouring.
Super interesting. And yeah, this is something I observed myself. The body shapes in Colombia are super different. As you know, my wife's Colombian.
Absolutely,
so
Stephanie. I know her very well, yeah.
So we spent a lot of time there, and it's...
But to be honest, not speaking too much about your wife, I think she's a little bit also hybrid because she's Colombian, but she has also, I think, European...
Swiss roots,
Switzerland, exactly. So we are a little bit kind of similar, her as a woman, me as a doctor. We are in between both worlds. And she's not really extreme. She's more European, but a little bit more curvy than the classical European. So this is the same style, yeah.
Exactly. Yeah, that's a
good choice.
Good choice. Thank you. So yeah, and what about the new trends? What are the new trends that you're seeing that our auditors may have heard of? Not yet. There are always so many new trends. We're talking about it in the previous episode. Some good, some bad. Some are just words put on typical treatment in the market.
So let's talk about 2025.
Yeah.
Where are we standing now? You know, everything in life is about swinging from different, direction.
Yeah.
And in the last maybe decade, 10 years, it was the era of big volume, big breast, big butt, following the trend, for example, of the Kardashian,
Yeah.
And what we see now, is a little bit the reverse of all this big volume era. And again, following the Kardashian, for example, you have seen that they basically dissolve their filler, remove their fat, remove their implants, go to smaller breast implant, etc. So we are now in 2025 in this direction of reversing a little bit what has been done in the last decade. So a smaller breast implant, a smaller BBL, less filler in the face. I would say more French touch now, more natural look. You have seen some celebrities like Lindsay Lohan. By the way, she was treated in Dubai, and you see how natural she looks. She looks less American, more European now. Also, the Kardashian mother, Kylie Jenner, very good, and fresh and natural look. Not aggressive like before, in the sense of not extreme like before, you see. So this is the trend now. I think more and more natural look, and we see that in the face and in the body and in the breast. Yeah.
Amazing. Now I'll jump to the part of this podcast where I told you about we love hearing about anecdotes.
Yeah.
And there are good anecdotes, bad anecdotes. What have you prepared for us today?
First anecdote is about the butt. So as we discussed before, the French butt is a small butt,
Yeah.
The brand Pretty Little Thing. I like to speak about the Pretty Little Butts.
Okay.
So one time I had an Emirati patient from Abu Dhabi working in the government of UAE. And she told me, Dr. Matt, I know you very well. I stalk you from A to Z. I know you do French butt, small butt, etc. But me, in my case, I want the biggest butt of the country. I said, but I'm not sure I can do that for you. Yes, but I am working in the government. So you have to listen to me. And if you listen to me, I will give you the golden visa. I said, no, my dear, this is too much for me. I'm a doctor. I do medicine. I don't want, to go in this direction because not only I don't think it looks good. I don't think it looks good. Sorry. Also because it's not safe.
Yeah.
So basically, she was asking me butt implant, 800 cc, way too much, double the size that I'm using, never more than 400, and to do extreme liposuction and to put all the fat. And I say no. She was a little bit surprised because she was a important person from the government. She came back 1 month after. Dr. Matt, I agree. Let's go down. Let's go to 600. I said no. I'm sorry. I don't want 600, it's too much. She came back 500. I say no. And finally, 3 months after, she came back. Okay, Dr. Matt, if you want, we do 400, but we do more fat. I accept. So I use a 400 cc implant and I did the whole liposuction. I put all the fat in the butt and it was really, technically it was a good result.
Yeah.
She's very happy, but very tiny waist, very big hips, very big butt. not my taste, I would say, as a doctor, neither nor as a man. But at the end of the day, we found a compromise. I achieved to downsize the implant. What was my goal, and at the same time, I went towards her, and she's happy. But I just want to make a little comment. She told me, Dr. Matt, I know you do small butts, but don't worry. No need to put it on Instagram. You will keep your French butt trend. That's fine. But me, I will be happy. And she's happy. So at the end of the day, it was a success.
So how much? So here we have some implants. I'll take that one. What's the 400cc compared to that?
I think this one, you can look, by the way, on the back. It should be
this one.
This one is, for example, 355. You can see here.
This one is maybe 450, if I'm reading right.
I will tell you. It's look. This one is 355.
Okay.
You can check this one, and I will tell you for this one. This is polyurethane. This one is 430. Yeah.
Okay.
Exactly. 430.
Okay. So it's All right.
But generally speaking, to give you a rough idea. As a doctor, I try never to go beyond 400.
Yeah.
Okay. Again, sorry to repeat, but it's so important. Small implants, small problems. Big implant, big problems. So when you go beyond 400, whether it's for the breast or for the butt, you are in the field of problems. That's why I hope you got from me all over this interview that I try to downsize and to compensate with fat.
Yeah.
And when I do a butt, I try to combine implant, small implant, and fat. When I do a breast, I combine small implant and fat. So this is the the concept of combining to have less complication and more efficacy.
That's amazing, and that's what we see with great doctors. Is that, as you said, they're selective with their clients, and also they do not accept to make everything. And
absolutely,
and that's so important.
We have to say no, and I'm very often saying no. We are not, businessmen trying to force to sell. No, the first goal is to avoid problems.
Yeah,
because it's a very difficult job. I can tell you, my heart is under pressure all the time. And if patients are happy, if we don't have problem with patient, this is at least a big victory.
Yes.
And then after, if we can have a busy practice, a lot of patients, even better. But first, no problem, no complication, no unhappy patient. This is the main goal. Yeah.
Amazing. Thank you, Dr. Matt.
My pleasure. Mr. Ivan, I was about to say Dr. Ivan because
not yet.
But can I ask you a question?
Yes.
Just as the end, because you asked me a question at the beginning, I didn't answer, but I would like to answer by a question.
Yes.
So why Dubai? Actually, I didn't answer, but I would like to give you 4 options.
Yes.
What do you think I came to Dubai in 2017? Number 1, because there is no tax. Everybody, is always referring, Dubai, no tax. But Number 2, for love. Number 3, lifestyle. Nice city, by the sea, a lot of activities. And number 4, for work activities. So what do you think?
Whew. All are plausible scenarios. So that's
what I'm asking.
It's either love or work. Which is the 4th?
Actually, it's exactly that. So basically, yes, I came initially for my ex-girlfriend. Unfortunately, we are not together anymore.
Okay.
But yes, it was initially for a French girl working here in Dubai.
Okay.
And she was working a little bit in the same industry. So we were combining, let's say, love and work.
Interesting.
And after 2 years, before COVID, of remote relationship.
Yeah.
After 2 years, she was very clear. She told me, "Listen, Matt, I know you since 2 years. I saw you maybe 10 times in my life. It's not enough for me. What do we do? Either we stop, or you go to Dubai." And men are very weak compared to women. So in 1 month, I was in Dubai.
Wow,
that's the story. So at the end of the day, it's love and work. Now we are not in this relationship anymore, but I'm staying in Dubai because, of course, I have now a 7 years practice. I'm quite happy. Lifestyle is good. Dubai is a vibrant city, so this is why I'm staying in Dubai.
Amazing. Thank you.
Thank you so much, Yvan. Merci.
Pleasure. Avec plaisir.
Maybe a little bit of French, because we are French speaking.
Amazing. And so viewers can find you also through the Aesthetic Links app at FMC Clinic.
Yeah, I am in a FMC Clinic, which means, by the way, French Medical Center.
Yeah.
Very easy to find, website, Instagram.
Amazing. Your Instagram will be below this video.
Yeah.
You post super frequently. You're a celebrity on Instagram and post super interesting stuff. So
it's quite interesting, by the way, just to speak about that, Yvan, and to speak about your Aesthetic Links, to see the difference between France and Dubai. In Dubai, basically, there is no Facebook. We don't use a website. It's WhatsApp, Instagram.
Yeah.
So when I moved from Paris to Dubai, I had also to adapt my communication, ways to the city. And I don't have really a Facebook. I don't really have a website. But yes, Instagram, Dr. Matt Stefanelli, and the WhatsApp link to it.
Amazing. Thank you so much. Thank you for watching through. We'll be back soon with the next interview. Please subscribe to Dr. Matt on Instagram and enjoy.